I can't bend my knee. Should I be worried? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. This is another one of the series of videos I'm doing where I answer really common questions. Regardless of the scenario, this is the essential question that people either send me or put on my website or in social media. So I really want to address it. And that pertains to any number of knee injuries where the prevailing symptom is, I can't bend my knee. Is this a big deal? All right, after a traumatic knee injury, you land badly from a jump, you plant your foot to change directions, maybe you feel a pop, your knee can swell up really big and your knee get really stiff. And that can be a bad sign, something like an ACL injury or something like that. Now, it could just be that it's pain and swelling related, and as soon as those go down, all of a sudden you can straighten your knee. All of a sudden you can bend your knee. But if you're really struggling, especially to get it all the way straight, definitely worth getting it checked out by a doctor. Or if you can bend it just a little bit, but you can't get it very far, probably another good sign that it's worth seeing a doctor. What I would really pay attention for is if you've got sort of a scenario where you injure your knee, maybe it's bent 20, 30 degrees, you can't straighten it at all, and you can't bend it at all, your knee is sort of locked in a certain position. There's a certain type of meniscus tear where the meniscus, the inner part, can get trapped in the center of the knee, blocking motion. It's called a bucket handle meniscus tear, and that's something worth getting checked out very quickly, because that almost always needs surgery so that you get your motion back, and so you can save the meniscus by having the surgeon sew it back together. So when you can't bend it, certainly can't get it all the way out straight, you think ligament damage like ACL tear, meniscus, something like that, sometimes even fractures around the knee, but something like that, definitely worth getting checked out. Hopefully it turns out not to be a big deal, but I think better safe than sorry. Find out fairly early on what it is and start taking steps to get over it. All right, have you suffered a knee injury and struggled to bend your knee or struggled to get it all the way straight? What did it turn out to be and how did you get over it? In the comments below this video, I'd love to hear your experience. And honestly, I think people watching this video from all around the world would as well. I can't answer questions you leave in the comments because legally I'm not your doctor, but I do read them so that I can learn more about what you're dealing with. All right, I also want to know the biggest injury challenge you face with your knee injury. I want to help give you the #1 next step to overcome it. In the description box below this video, there's a link that takes you to a very quick few question, almost survey, but it's just basically point and click answers that can help me understand your injury so that I can give you the #1 best step for you to help you overcome that injury. Go to the description box, top link, you will see that. All right, I also record a number of videos every single week, and sometimes some live videos where you can leave comments and ask questions. So subscribe to my video channel. I record a number of videos on sports and exercise injuries and injury treatments and injury prevention. So click the subscribe button in the upper right corner of the page. They'll get delivered directly to you. Thank you so much for watching. I hope this video on knee injuries was helpful, and I'll see you right here next time.